So in this video we are going to talk about the functional assessment for the cervical spine. So functional assessment, if the patient has any difficulties in particular function or activities of daily living, ADL, the functional assessment should be performed if the examiner finds any particular difficulty. Functional assessment should be performed considering the patient's age and existing health condition. It has all the components of activities of daily living, starting from breathing, swallowing, looking up at the ceiling, looking down at the floor, chin tuck, chin out, and paresthesias or shoulder rotation. So we'll start with the breathing first. So breathing. In patient, normal and unlabored breathing should be observed, particularly with the mouth closed. If the patient is struggling to breathe, or patient is trying to gulp some air or grasping the air, that means patient has difficulty in breathing and cervical spine may be responsible. Respiratory muscles, for an example, diaphragm is supplied by the phrenic nerve and the root value is C3 to C5. So breathing is an important functional aspect to check in functional assessment for the cervical spine. Second is swallowing. Swallowing is a very complex movement after mastication. In swallowing, so many muscles are responsible, starting from muscles of the lips, tongue, jaw, pharyngeal muscles, laryngeal muscles, suprahyoid and even infrahyoid muscles. So clinical observations suggest that if the patient has difficulty in swallowing, chronic patients with cervical spondylosis may have difficulty in swallowing or dysphagia. Third, looking up at the ceiling. So 40 to 50 degrees of cervical spine extension is necessary for all day-to-day activities. For an example, changing the light bulb, cleaning the ceiling fan. So if the patient is lacking in that range of motion in cervical spine extension, patient may compensate with bending the trunk or bending the knees or sometimes even both. Fourth component, looking down on the floor or looking down at shoelaces or looking down at belt buckle. So 60 to 70 degrees of cervical flexion is necessary for activities of daily living. If the patient cannot maintain that much amount of cervical flexion, patient may bend the trunk. Some of the examples are vacuum, mop the floor. Coming back to fifth, shoulder check or cervical spine rotation. 60 to 70 degrees of cervical rotation is necessary for activities of daily living. If the patient don't have that much of rotation, patient will rotate the entire trunk to compensate. A very classical example is driving the car. To check the rear mirror or check the blind spot while driving, cervical rotation is very much necessary. 6. Chin tuck. So tuck the chin in. While patient performs the chin tuck, the upper cervical spine goes for flexion and lower cervical spine goes for extension. Chin tuck is a very important aspect when maintaining a good posture where the ears are just above the shoulder. Chin tuck will strengthen the deep neck flexors and lower cervical spine extensors. It will stretch the suboccipital muscles at the base of the skull and even the scalene muscles. 6. 7. Chin, poke the chin out. Poke the chin out is just a component while performing the functional assessment for the cervical spine. But if that is maintained for a prolonged period of time, that will lead to headache and undue stress on the neck and the shoulder muscles. Number 8 is paresthetia. Paresthetia is very dangerous when a patient is cooking or handling the utensils. So paresthetia should be checked in functional assessment. Now all these 8 components, if this is not corrected or if these functional aspects are not corrected, it will lead to impaired proprioception in a cervical spine. And this all functional aspects are even important for clinical decision making. Now what's the solution? Solution is neck strength or strength in the cervical spine musculature. How examiner can check the strength in cervical spine muscles? Number 1, tension scales or manual muscle testing. Or second, by pressure stabilizing biofeedback devices where a patient can see how much pressure he or she is exerting while contracting the cervical spine muscles. Now, there are two tests or two scale where examiner can check the functional strength. So first is a functional strength test. It has 4 components where examiner can check the cervical spine flexor muscle, extensor, side flexor and rotator. Starting with the flexion. So to check the flexion, patient is in a supine lying position. Ask the patient to lift the head, maintaining the chin tucked in. If the patient can able to perform between 6 to 8 repetitions, that means patient has a good strength or a functional strength in cervical spine flexor muscles. To check the rotation or the cervical spine rotators, ask the patient to lift the head off the table, maintaining that, rotate the head to one of a side and hold that rotation for 20 to 25 seconds. Check on both the sides. If the patient can maintain between that much time frame, patient has a functional strength in cervical spine rotators. To check the side flexors, so patient is in a sideline position, the head is supported with a pillow. Ask the patient to lift the head off the table. If the patient can maintain that side flexion for 20 to 25 seconds, patient has good strength in cervical spine side flexors or a functional strength. Check on both the sides. Check the extension or the last 4th component. So patient is in a prone lying position. Ask the patient to lift the head off the table. If the patient can hold that extension movement for 20 to 25 seconds, patient has a functional strength in cervical spine extensor muscles. The second scale is a neck disability index. Neck disability index will give objective assessment or give a number to an examiner. That is very important, where you pass the information to doctors so that the doctors can come to know how severe a patient is. So neck disability index is a modified version of Oswestry lower back pain scale. Neck disability index has 10 subparts to check, starting from pain intensity, personal care, reading, lifting, headache, concentration, work, driving, sleeping and recreation. All these 10 items are evaluated on a severity from 0 to 5. Now, as I said, it will give an objective assessment, like give a number. So, if the patient falls between 0 to 4, that means no disability. From 5 to 14, patient has a mild disability. From 15 to 24, patient has a moderate disability. From 25 to 34, patient has a severe disability. And if patient is greater than 35, patient is fall between greater than 35. So patient is completely disabled. Thank you.